5 seconds to go. Start. We all said that it should be achieved. Unfortunately, drug trafficking is increasing in the entire state. I would like to request the government to allocate a separate budget for this and make at least one rehabilitation center in every district. Drug addiction has assumed alarming proportions across the country, almost in every state. According to the United Nations Office on Drug Abuse, 70,000 people are reportedly addicted to drugs in Jammu and Kashmir. So, it does not only impact 70,000 people, it impacts their families. In the last few years, 1 lakh people are on the streets of Srinagar who are not getting work. They are need based employees, daily wagers, casual workers who are not getting regularized. It is not that every case will end up in drug abuse, but it is likely that the people who are affected by all this lack of empowerment fall prey to drug abuse. There may be a number of reasons in the case of Jammu and Kashmir. Enforcement agency is also not up to the mark because we do not have special investigating officers. We should have specialized force in almost every police station, more so in the police stations which are in vulnerable areas. Then we must have awareness at the grassroots level. We must engage the civil society groups because they have an impact. We do not have adequate number of de-addiction centers. At least there must be one center in each district. If we wish to fight a war against drug addiction, we should start at the grassroots level. We have brought an amendment to the NDPS Act. In 2001, the definition of a small quantity was altered. Small quantity of ganja was earlier specified as 500 grams, whereas in the notification issued pursuant to the amendment, it was increased to 1000 grams. Every offender who commits very serious offense is not given punishment according to the gravity of the offense. We are the lawmakers of this country. As the lawmakers, we are duty bound to see what is to be done. We have to dedicate ourselves to scan and plug the loopholes in the legislation. Drug mafia has spread its net even in schools. There has been an unprecedented growth of diseases which affect liver, respiratory system, neuro, heart, cancer, etc. Alcohol consumption is the main reason. We are doing certain things, but that is not sufficient. If we do not act properly with regard to this issue, we will be called as culprits in the history. In order to achieve this noble cause, we have to work hard. From the year 2003, our government took a resolution to make India drug free. Today, after 19 years, once again we are expressing concern about drugs. Our young children are inclined towards drugs. This is a matter of concern. I have full faith that our government will surely find some way or the other to save the youth of the country from this crisis. The government is committed to curb drug abuse. Various central agencies have been empowered under the NDPS Act 1985 to exercise strict control over the movement of narcotic drugs and psychotropic substances. Anti-narcotics task force has been set up in all the states which will have the power to investigate major cases related to narcotics. Bilateral agreements have been signed with 27 countries for its prevention. Memorandums of understanding have also been signed with 15 countries. Agreements have also been signed on security cooperation with Germany and Saudi Arabia. The Home Ministry, in collaboration with the NCB, also organized a national conference on drug trafficking and national security in Chandigarh and two regional conferences in Guwahati and Gandhinagar, which have been instrumental in promoting anti drug trafficking operations and coordination between the state and central governments. Several honorable members also spoke about rehabilitation centers at the district level. We will not be able to find a solution to the problem by just taking care of this thing only. We have to lead India in such a manner that these types of problems should not arise in our country. Through discussion and guidance, we should make efforts to ensure that our children do not use drugs. As the country progresses, this kind of problem is definitely going to arise. Money brings several types of diseases with it, so we need to create a mechanism to prevent our people becoming victims of drug abuse. At present, drug abuse is a matter of great concern for India and it is increasing day by day. During the last 10 years, the number of cases registered under the NDPS Act 1985 has doubled, which shows that this is a very alarming situation in our country. Even 10 to 17 years olds are using drugs. Today, the methods of drug trafficking have changed. Earlier, drugs were smuggled through land routes, but today 70% of drugs are smuggled through the sea routes. I would like to say that the biggest problem today is the source of origin of drugs. The second is prevention, the third is enforcement. As long as source and supply are not stopped, prevention and enforcement will not be effective. It is the responsibility of the Constitution of India to control the supply and source. Bilga is a village situated in my parliamentary constituency. There, 35 young boys from the same village died due to drug abuse. Revenue of 60,000 crore rupees is going abroad from Punjab due to drugs. People are sending their children abroad due to this problem. Punjab is again going through a dark phase. I would like to request the government of India that a national drug policy should be formulated for enforcement and prevention, and there should be an interstate coordination so as to check drug trafficking across the borders of the states. Similarly, attention should also be paid to the dry ports. With the increasing number of drug addicts in the country, India needs a plan to control this problem. This can only be done with the help of detailed studies on the type of drugs being abused, age group of addicts, states with the highest consumption of drugs, and availability of de-addiction centers. Nearly a decade ago, the United Nations conducted a survey on drug abuse in India. The report had highlighted that most of the drug addicts were young. About 95% of them were male. The survey of substance abuse 2019 shows that now drug addicts are in the age group of under 10, having its range up to those who are on the wrong side of 70. Along with this, the number of women consuming drugs is also on the rise. In case of being stripped of enough money to buy drugs and narcotics, they resort to beginning borrowing and sometimes even burglary. However, there is a yawning gap between demands for treatment and the availability of services for their cure. Introduction of therapy programs at the national level is the need of the hour. In addition, we need more government aided de addiction centers with proper access to medicines, doctors, and psychiatrists, along with treatment of the patients. From time to time, it has been proved that prevention is better than cure. Prevention programs against drug abuse need to be run in schools, colleges, housing societies, family clinics, and hospitals. Stop.